Hi, I'm Dr. Tom Dawson, and today I want us to talk about something that's a little bit more fun, and that's pinworms. When a doctor says something's fun, that usually means that it's pretty straightforward to diagnose, pretty easy to treat, and that we haven't had a patient that's been seriously harmed by it. So in that realm, pinworms are fun. Now, in the real world, pinworms would probably cause more anxiety, at least pinworms and head lice. The two combined would probably cause more problems and anxiety in moms than the rest of the illnesses that I treat put together. But they're not bad. So let's talk about what they are and why we shouldn't be worried about them. So pinworms are little white, half-inch, quarter-inch to half-inch, less than a centimeter, white worms that live kind of in the south end of our intestine, down by the rectum and anus. During the day, they don't really cause us too much in the way of trouble. Most people wouldn't even be able to tell that they had them. But at night, the mama pinworms somehow are smart enough to know how to go out and to round the rectum, and they lay their little eggs on the outside at night. And then where they lay the eggs, it makes your child's bottom a little bit itchy, and so they tend to scratch their bottom the next day and sometimes get some of the eggs under their fingernails. And then when they're playing with their buddies, and they sometimes touch the hands of their buddies, and the eggs pass to their buddies' hands, and if they put their hands in their mouths, and then they swallow the eggs, and they go down to the south end of their intestine, and they start to hatch and grow, and the cycle continues. So that's how they spread. So then how do we know if we have them? How do we diagnose pinworms? So from my standpoint, there's only two ways to really diagnose pinworms. Either you see a little tiny quarter to half-inch white worm wiggling around, and sometimes we actually get you to look for them. If we think your child has pinworms, we frequently will have you sneak in your child's bedroom at night with your flashlight, spread the cheeks of their bottom, and look and see if you can see some of the mama pinworms laying their eggs at night. So if you see a little wiggling white worm, your child has pinworms. This is not a medical emergency, and you can wait until the next morning to call your doctor's office in order to fix this. The other way to diagnose pinworms is by seeing their eggs. And in the old days, we used to take clear Scotch tape. And I don't mean the invisible kind that's kind of cloudy looking. I'm talking about the clear cellophane tape. And we would take a piece of that tape and press it around their bottom, the anus, first thing in the morning before they'd have a chance to walk around or wipe themselves or do anything. And we can frequently collect the eggs on that tape. We would then take that clear tape and put it on a glass slide and put it under the microscope. And then we could actually see the little eggs under the microscope. And the coating on the eggs were so thin you could see through it and actually see the little worms inside. And so while the old days were kind of nice that we got to do more of the labs ourselves, and you could be pretty convinced that if you saw eggs with worms in them that a child had pinworms, there were some drawbacks to the old ways. Back then, you used to have the mom bring the tape in on a piece of aluminum foil, and that was a little messy and probably a good way to spread a few pinworms in the process. Now the lab will give you a little test tube that has a screw top and a little paddle inside that has a sticky material, and you can use that to spread their cheeks in the morning and press it around the anus to collect the eggs, put it back in the tube, screw it down tight, and take that into the lab. So that's probably a little cleaner now. And so once we find out that we either see wiggling white worms or we collect the eggs to be seen under the microscope, that's how we know. If we see white stringy things in children's poop, that does not mean they have pinworms. Anyone who's seen enough children's and babies' poop knows there's white stringy stuff in their stool all the time that most of the time is not pinworms. So now we diagnose pinworms. How do we treat it? Well, fortunately, pinworms are really easy to treat. The problems with most things that we treat in medicine is that we have a hard time getting the medicine where we need the medicine. It's difficult to get the antibiotics to your sinuses or to the fluid behind your eardrum to treat those kind of infections. It is really easy to get the medicine that we're treating pinworms. We just put it in your gut, it stays in your gut, and it kills the pinworms. I would compare it frequently to if you pour gasoline on the grass in front of your house, you take a gallon of gasoline, you pour it on the grass, it kills the grass. You probably don't have to come back 2 weeks later and put more gasoline on the grass. That gasoline is usually dead. In the case of pinworms, we usually will treat it. There's plenty of medicines that will kill them. The easiest is probably parental pamoate, which is available over the counter, so you can ask your pharmacist to give you a pinworm treatment. They take the medicine, it kills the pinworms. Frequently, we will treat them again in 2 weeks. Most of that is probably psychological warfare to help the moms. Possibly, occasionally, there will be a stray egg that didn't get killed that may find its way back into their system to reinfect them. So we usually will retreat in about 2 weeks. And while we're killing the pinworms with the medicine, let's go ahead and cut your children's fingernails really short. When they're scratching their bottoms, those pinworm eggs like to hide under long fingernails, so let's not give them a place to hide. And during those same 2 weeks, let's wash their hands a few extra times, and let's gather up all their clothes and all their bed linens, and let's wash those in some really hot water, because that will help too. There's always a question, should we treat the entire family? I would say usually it's not medically necessary if no one else is showing symptoms. Certainly adults are pretty good about after they have changed their baby's diapers or messed with their children's bottom to clean them, are good about washing their hands. If you're not, I recommend that you do wash your hands after doing those things. So it's usually not necessary to treat the entire family. If you have siblings that play together and are young and not too good in the hygiene department, then probably treating those children is fine. And if the pinworms are driving you crazy as a mom, then I'd say, yeah, go ahead and it's okay to treat the whole family. So that's pinworms. Easy to, straightforward to diagnose, easy to treat. The only problems that I've ever had probably with pinworms is occasionally in little girls, the worms get a little confused about where they live. And so instead of staying in the rectal area, they sometimes will move into the vaginal area also, where they cause a certain amount of irritation. So it's not a big problem. They're still easy to treat, but that's about the only other fairly common complication that we sometimes will see. So no one in my practice has ever been severely hurt by pinworms. They're easy to treat. I don't want this to keep you up at night. So I hope this will help a little bit.